A very fundamental question. You're talking about removing cost from the system in terms of reducing doctors' visits and reducing hospital visits, which is great in the grand scale, but those are your customers, and you're really talking about erasing revenue from doctors because they will see fewer patients, and erasing revenue from hospitals because there will be fewer admits. How are you going to sell these to doctors and hospitals?
We don't really see it as a revenue reduction for a couple reasons. One is that through remote access, physicians will be able to target more patients than they would if the patients are just coming into their office. So even if they're getting smaller revenue per patient, they're getting more patients, and we think that that's going to make up some of that gap. Hospitals don't like patients who come in and use the ER as their primary care office. It's an inefficient use of resources. If we can eliminate some of those visits from patients who really don't need to come into emergent care, we can make the visits that are there and the beds that are taken up patients who are generating more revenue for the hospitals.